Welcome to the Constellation Health Services 2017 Open Enrollment Benefits Presentation. Online open enrollment begins November 14th and ends December 2nd. All benefits become effective January 1st, 2017. My name is Steva Susi and I am with the Cornerstone GenCorp Hill Group. We are your benefits advisory firm located in Warwick, Rhode Island. In this presentation, we will review all the benefits available to you and go over any benefit changes, including new offerings that take effect January 1st, 2017. You should have already received your benefits booklet in the mail. There is also a copy posted on your benefits portal, www.nathealthcarebenefits.com. This presentation will highlight information included in your booklet, which you can always refer to for more detailed information. Let's take a look at what's new for January 2017. We have made some slight modifications to the medical plan designs. These changes are detailed on pages 11 and 12 of your benefits booklet. In addition, we are excited to introduce two new benefits: a flexible spending account, or FSA, and a voluntary critical illness plan. There will be no changes to any of the other benefits. As a reminder, please be sure to use the Benefits Helpline at 1-800-201-7898 to reach one of our benefits advocates if you have any questions on any of the benefits. The Flexible Spending Account is a new benefit program which allows you to set aside pre-tax dollars to pay for eligible out-of-pocket healthcare expenses like deductibles, co-pays, co-insurance, prescriptions, dental, vision expenses, etc. You pay for these expenses with your Optum payment card, which you will receive in the mail if and after you decide to enroll in this benefit program. You can choose to elect any amount from a minimum of $520 to a maximum of $2,550 per year. The annual amount is deducted from your paycheck in equal amounts before taxes each pay period. The entire annual dollar amount you elect to set aside in your healthcare FSA is available to you on the first day of your plan year, or January 1st. Please note that the healthcare FSA is only available to employees who either waive coverage or enroll in the premium, standard, or basic medical plans. Those enrolled in either of the HSA plans are not eligible to enroll in the FSA. If you and your spouse are working, looking for work, or enrolled as a full-time student, you may also be able to elect to set aside pre-tax dollars in a dependent care FSA to help pay for daycare, childcare, preschool, and summer day camp expenses for children under age 13 or for qualifying dependent adults like elderly parents. You may elect any amount from a minimum of $520 to a maximum of $5,000 per household per year. It is important to know that while the entire amount you elect in your healthcare FSA is available to you on January 1st, the amount you elect in your dependent care FSA is not. The amount available to you in your dependent care FSA is based on the amount you have contributed to date. It is also important to know that the use it or lose it rule applies to your FSA. This means that you will lose any money left in your FSA account at the end of the plan year. It is recommended that you keep all receipts for your healthcare FSA expenses in the event you are asked to provide proof that they meet IRS requirements. You may only change your FSA election amount under special circumstances, defined as a qualifying change in status, such as, for example, a marriage, divorce, birth, or adoption of a child. You will automatically be enrolled in the pre-tax premium payment program unless you provide written notice to your HR manager declining enrollment. Automatic enrollment means that your share of the medical, dental, and vision insurance premiums will be deducted from your paycheck pre-tax, which reduces your income tax liability. You may not change your pre-tax election unless you experience a qualifying event such as a marriage, divorce, birth, or death. To be eligible for benefits, employees must be scheduled to work at least 30 hours per week and must have satisfied the waiting period. For those newly hired, benefits begin on the first of the month following a 30-day waiting period. Online enrollment instructions are found on page 6 of your benefits booklet. Once you have elected your benefits, you can print out a confirmation of your elections. The medical plans offered vary in benefit levels and costs to meet all employees' needs. You do not need to have a primary care physician or PCP under any of the plans. However, we strongly encourage it. Establishing a relationship with a PCP allows your PCP to know your health history and direct your care accordingly. This also helps in addressing any health concerns before they become serious. Plus, your once-a-year visit to your PCP is of no cost to you. Healthcare reform provides that annual checkups and preventive screenings, in addition to certain other services when provided in-network, are covered at no cost to you. The Teladoc benefit was introduced last year. It provides consultations with U.S. board-certified physicians by telephone or video 24 hours a day, 7 days a week, 365 days a year. It is a convenient alternative to urgent care or emergency room visits. You can use this service after normal office hours, while on vacation, or any time a doctor is not available. It is meant to be used for non-emergency medical assistance, for treatment of conditions like a sore throat, the common cold, the flu, pink eye, sinus and allergy problems, pediatric care, etc. Before you can request a consultation, you must set up your account online at teladoc.com/Aetna. If you need assistance with setting up your account, you can call 1-855-TELEDOC. When setting up your account, you will provide required medical information, so your history is available to the consulting doctor. Once your account is set up, you can log in and request a phone or video consultation whenever you need it. The doctor will review your medical history and recommend treatment and/or prescription. There is little or no cost to you for this service, depending on the medical plan you choose to enroll in. As a reminder, you have access to an Aetna Concierge Personal Assistance, which you can call at 1-800-533-8436 if you have questions about your benefits. On pages 11 and 12 of your benefits booklet, you will find the health plan comparisons. Please be sure to review them carefully. You will notice some changes in deductibles, copays, prescriptions, and coinsurance. It is important to know these changes before you make your plan selection. Effective October 1st, 2016, Optum Rx replaced Aetna to manage your pharmacy benefits. You will receive a separate ID card from Optum Rx that you must use for pharmacy services. You will continue to use your Aetna ID card for medical services. Page 14 of your booklet provides details of the pharmacy benefits in accordance with the medical plan you choose to enroll in. Be sure to review these carefully, as there have been changes to both retail pharmacy and mail-order prescription drug costs. In addition, be sure to review the list of excluded drugs that Optum Rx will be sending to your home. It is recommended you talk to your doctor about the drugs you take and possible less expensive generic alternatives. Two websites that you can use to comparison shop the price of prescription drugs are www.optumrx.com/mycatamaran and www.goodrx.com. If you choose one of the two HSA plans, you may open up a health savings account. You can deposit money into this account and use it to pay for qualified out-of-pocket medical, dental, and vision expenses for yourself, your spouse, and your tax-dependent children. Qualified expenses include deductibles, copays, coinsurance, prescription drugs, wheelchairs, hearing aids, etc. For a complete list of qualified expenses, visit www.irs.gov. With your HSA account, you will pay for covered services until you meet your deductible. You can pay directly with a debit card that is linked to your HSA account. You can also pay online from your HSA, or you can transfer funds from your HSA to your personal bank account. The Aetna Navigator website offers tools to research costs, check your account balance, track and categorize expenses, attach receipts. You are encouraged to save all receipts for qualified expenses. You can contribute to your HSA account anytime up to an annual maximum set by the IRS. For 2017, the maximum you may contribute is $3,400 for single coverage and $6,750 for family coverage. If you are age 55 or older, you may contribute an additional $1,000. You may contribute by convenient payroll deduction, and you can change the amount of your contribution at any time. Constellation Health Services will contribute to the HSA account for 2017 for those employees enrolling in the HSA plan or the Bronze HSA plan. Constellation's contribution will be $750 for single coverage, $2,000 for Employee Plus One, as well as family coverage, in equal amounts over 26 pay periods. Withdrawals from your HSA account for qualified expenses are tax-free. Non-qualified withdrawals are subject to income tax plus an additional 20% penalty if under age 65. After age 65, non-qualified withdrawals are taxed as ordinary income, but there is no 20% penalty. There are no changes to your dental plan benefits. You will have the same 3 dental plan options that you currently have with Delta Dental. To review the plan highlights, you have a low plan, a medium plan, and a high plan. The per person deductible is $50. The family deductible is $150. Calendar year max per person is $1,000 on the low plan, $1,200 on the medium plan, and $1,500 on the high plan. Preventive and diagnostic services are covered at 100% with no deductible. Basic services are covered at various rates after the deductible. See page 18 in your booklet for detailed plan benefits. There are no changes to your vision plan benefits. They will renew with Aetna. To review the plan highlights, this plan provides for routine eye exams, contact lenses, and eyeglasses, including designer frames. Retailers include LensCrafters, Pearl Vision, Sears, JCPenney, and Target Optical. See page 20 in your benefits booklet for benefit highlights and costs. There are no changes to your group life and disability insurance plan benefits. See page 21 in your benefit booklet for plan benefit highlights. There are no changes to the existing voluntary employee paid plan benefits. They are offered through Colonial Life. Voluntary benefits offered are group non-occupational accident insurance, group medical bridge or hospital confinement insurance, and cancer insurance. A new benefit added this year is a critical illness plan. This plan provides a lump sum benefit that can be used to pay for direct and indirect costs related to a covered critical illness, such as a heart attack, end-stage renal failure, coronary artery bypass surgery, and stroke. Pages 23 and 24 of your benefits booklet provide information about your right to continue medical coverage and notice of electronic access to important healthcare information. This concludes the open enrollment benefits presentation. Thank you for attending. All the information presented here is meant to provide an overview of some of the benefits available to you as an employee of Constellation Health Services. Please refer to your benefits booklet and each plan benefit summary for more detailed information.